Fuller winding up for the Lib Dems.
Thank you, Ms Furness. It's a pleasure to serve under your chairmanship. So I'd like to begin by congratulating the Honourable Member for Washington and Gateshead South for securing today's timely and important debate on the first anniversary of the Hughes Report. She has been a tireless champion for those harmed by pelvic mesh and children born with birth defects as a result of sodium valproate, and I commend her work as chair of the First Do No Harm Mesh Primidos Valproate All-Party Parliamentary Group. That's a mouthful. Thank you for that, Honourable Member. Couldn't have been a bit shorter, of which I am also a member of. In 2024, the Patient Safety Commissioner estimated that at least 10,000 women in England have been harmed by vaginal mesh implants, some involving the mesh slicing into the bladder, bowels or vaginal wall of these women, leaving them in permanent pain, sometimes unable to walk, work, have sex, leaving their lives changed profoundly. And as multiple honourable members, including the member for New Forest East, mentioned, the campaign group Sling the Mesh believes that actually the true number could be closer to 40,000 women. So when Dr. Henrietta Hughes agreed to take forward this report, she made one thing very clear. This was not to be another review that just gathers dust. This report must lead to action, not just words. And we are now a year on and the people affected are still waiting. The Hughes report makes the case plainly. There is a clear need for redress. These women were, in most cases, not failed by a single doctor or a one-off error. They were failed by the system, by healthcare structures, by regulators, and by governments who did not listen when they should have. The redress we need is not about blame, it's about restorative justice, co-designed with the patients and distinct from adversarial court proceedings, where, as other honourable members have mentioned, women are having to relive their experience and their trauma time and time again. So the Hughes report recommended establishment of an independent redress agency, and the lack of clarity on creating a bespoke redress scheme has left those patients in limbo, and that limbo is deepening the harm, as the Honourable Member for Salisbury shared some useful insight with the room from his learnings from the infected blood scandal. In my own constituency of Chichester, several women have shared their stories with me. These are stories of being dismissed by clinicians, of medical records being incomplete or inaccessible or not reflecting the true circumstance that these women are under, of suffering through chronic pain and ill health even after the mesh has been removed. I've met two of these women in person, one of which I met in her own home, because she is so profoundly injured and traumatised she no longer leaves her property for any reason. With no access to social media or the outside world, my constituent had no idea that she wasn't alone. She had no idea there was a national campaign for justice and felt totally alone, embarrassed and broken by the circumstance. So I promised to stand by her and with the thousands of others up and down the country who have been failed. I will just take the opportunity to mention Paula Goss, who is a national campaigner and constituent of my honourable friend, the member for Thornbury and Yate. Paula was affected by mesh procedure, which was not covered by the original Cumberledge Review. The surgeon involved in her mesh procedure was found guilty of serious misconduct, but only suspended for 6 months. Of the 462 patients harmed at the Spire Private Hospital and the Southmead Hospital, just 5 were called as witnesses to the General Medical Council. And when Paula tried to complain, she was told she was out of time, as many members across the House have reflected today, and that it wasn't in the public interest to waiver the deadline. How can we call this justice? That's not justice, and it's not accountability. And cases like Paula's and those raised by my constituents in Chichester are why we as Liberal Democrats believe that the entire set of recommendations in the Cumberledge report must be implemented without further delay. And this scandal isn't limited to mesh and sodium valproate. The same approach must be extended to other medical device scandals like Primidos. We cannot continue to treat each crisis as an isolated issue. We need a system-wide approach to patient safety and accountability, and that means a duty of candour on public officials. So the Liberal Democrats would achieve this by establishing an office of the whistleblower so that safety concerns can be raised without fear or delay, and that means embedding patient voices into the heart of our healthcare system, not as an afterthought but as a fundamental principle. Earlier this year, 100 women secured a financial settlement from mesh manufacturers. This is a drop in the ocean when it comes to the number of women that deserve redress. Every single woman affected by this scandal deserves proper compensation, not just those that are able to bring forward lengthy and difficult legal claims.
The Honourable Member, please give way.
Happily give way to the Honourable Member.
I'm grateful to the Honourable Member for giving way. The Hughes Report actually recommends that those women affected by pelvic mesh should receive an initial interim payment of £25,000, followed by a main payment afterwards. Does the Honourable Member agree that with all the women that the Honourable Member has mentioned, that interim payment will be of some comfort to these women so that they could at least begin to try and get some redress and to make some improvements with their lives?
And the Honourable Member lays out from a real place of experience and knowledge. So who am I to come against anything that he says as the expert in the room? I totally agree that that would provide some reassurance that their cases have been heard, recognised by this government. And finally, Ms Furness, we are still waiting for a formal response from this government to the Hughes Report. So it was promised in due course back in August. Due course has come and gone. These women have waited long enough. People who have already suffered for years should not be forced to wait any longer for the compensation and recognition that they deserve. So let's end this culture of delay, disbelief and denial, and let's do what we should have done years ago.